our video training guide for the J-tip needle-free injector. In this video, we will demonstrate the 4-step process of using the J-tip as well as the best practices that should be observed. Let's begin by learning about the J-tip and how it works. The J-tip is a needle-free, sterile, single-use jet injector that delivers lidocaine subcutaneously using compressed CO2 gas. The CO2 gas creates a fine stream of liquid anesthesia that exits the device through a small orifice and passes through the skin. This creates a spray-like pattern of medication once inside the subcutaneous tissue, allowing for broad dispersion and quick absorption. Jet injecting lidocaine with the J-tip is a fast and effective way to reduce pain and help make patients more comfortable during common needle procedures like IV starts and blood draws. The J-tip is FDA cleared for use with lidocaine. Many facilities use 1% buffered lidocaine to minimize any sting or burn that can be associated with standard lidocaine. However, if buffered lidocaine is not available, 1% preservative-free lidocaine can also be used. Filling the J-tip can be done either by the appropriate clinical staff, your hospital's pharmacy, or a third-party compounding pharmacy. Pre-filled J-tips from a pharmacy will be ready to use as needed. If the appropriate clinical staff will be filling the J-tip, they will need a standard luer-lock syringe to transfer medication into the device. Some hospitals may provide pre-filled luer-lock syringes, however, medication can also be drawn from a vial. Prior to filling the J-tip, make sure to tap out any air bubbles from the luer-lock syringe. To fill the J-tip, attach the filled luer syringe to the J-tip. Make sure the connection is snug and then transfer medication into the device. Be careful not to overfill, as medication cannot be withdrawn once inside the J-tip. Select a subcutaneous injection site near where your patient will be receiving an IV or other routine needle procedure. Disinfect the area and allow it to air dry. If your injection site is near a vein, you can inject to the side of the vein, or you can use the Z-track method. To use the Z-track method, remove the orange luer cap and make a bullseye impression with the end of the J-tip over the site where you plan to start the IV. Using your less dominant hand, pull the skin away from the vein during the injection and then release the skin once the injection has been given. If your patient's vein rolls with the skin when you attempt to Z-track, release the skin and inject to the side of the vein instead. Never inject directly over a vein. Before using the J-tip, check and confirm the medication dosage and expiration date. To prepare the J-tip, remove the orange luer cap, then gently lift up on the white activation lever and slide the orange safety collar forward. Note that a pre-filled J-tip will have an orange sterility cap in place of the orange luer adapter. Once you are ready to give the injection, hold the J-tip at a 90-degree angle as shown. Hold the J-tip against the skin with enough compression to create a small dimple. Remember to face the exit port away from yourself and your patient, as this is where the compressed CO2 is exhausted. Squeeze the activation lever inward until you hear a pop sound and continue holding down for an additional 2 to 3 seconds. The sound the J-tip makes is